Hi everyone, I'm Dr. Chandler. I'm a plastic surgeon in Connecticut, and this video is about what to expect before and after periareolar top surgery. So I'm going to go through one of my patients' preoperative evaluations and their markings on the day of surgery. You'll see a few pictures from the actual surgery, and then you'll see how they're feeling after surgery and how they're doing at their first few postoperative visits. So today, our patient being interviewed is Devin, who was born female and identifies as non-binary, meaning that Devin does not identify as either male or female and basically falls outside of the traditional gender binary classification. Often, non-binary individuals feel uncomfortable with the presence of the breasts because they represent an incongruence with their inner sense of self. I've had patients who are non-binary request that we get rid of the nipples entirely, and others prefer that we keep them. Some request a completely flat chest wall, and others prefer a small A-cup breast. Ultimately, the goal is to contour a chest wall that is more congruent with the inner sense of self and helps patients feel more comfortable in their bodies and that feel that their physical characteristics are more representative of who they are inside. So here is what Devin's chest looked like before surgery. You can see that there is a small amount of breast tissue present and that the nipples are pretty high on the chest wall. So this type of anatomy is perfect for either a periareolar or a keyhole approach to removing the breast tissue. And both of these approaches involve removing the breast tissue through a very small incision along the inferior border of the nipple areola complex. And the scar ends up really nicely hidden along this border between the normal breast skin and the colored areola skin. The difference between the periareolar and the keyhole approach just has to do with whether or not we are trying to reduce the diameter of the areola. So with the periareolar approach, we are reducing the entire diameter of that colored areola skin, and with the keyhole approach, the incision is just along the inferior border with no adjustment in the diameter of the areola. Usually the areolas become smaller and more oval with the periareolar approach, although I have had patients request a more circular areola appearance, so it just depends on patient preference. Devin wanted to be completely flat-chested and wanted to preserve the nipples. The areolas around the nipples were slightly on the larger side, so we decided to do a periareolar approach involving both removing the breast tissue as well as reducing the areola diameter. Devin's areolas measured 32 millimeters in diameter preoperatively, which is really normal for a female areola, but the aesthetic male nipple is closer to 21 millimeters in the vertical dimension and 28 millimeters in horizontal dimension. So the more masculine nipple aesthetic is smaller and more of an oval. So I always discuss this with patients, especially with non-binary patients, because some of them prefer this more masculine aesthetic that is traditionally more masculine, while others prefer a more neutral look that is neither masculine or feminine, and some prefer to just leave the areolas completely alone. And again, some would prefer that the nipple areola complex be removed entirely. So let's go see Devin on the morning of their surgery.
I have known plenty of people who got top surgery. One of my friends from high school got it when we were in high school, and I didn't really think that was for me because I wasn't a trans man. But yeah, I met more people who had it, and that they just made me want to do it more because they were like, it was not a big deal, and now I'm so much happier, and I'm like, wow, that sounds great, that makes sense. And as soon as I started binding, I was like, oh, this is not sustainable for the rest of my life. I can't bind for the rest of my life. They have like a really super, super tight, hard fabric on the front to make you super flat, and then it's really stretchy in the back. Okay. So you can breathe pretty well in it, but it flattens really well. It's just like a really intense sports bra. I guess I don't want to subscribe to the gender norms that we have in a Western society because they just don't fit the way that I live or the way that I act or the way that I feel. But yeah, there's always been like signs that I was not I was never hyper feminine or anything. So, but I am also sort of recognized that socially I probably won't be perceived as a man for a lot of my life, and I'm okay with that, so I'm okay with being somewhere in between. Like, I want people to look at me and be confused, and be as confused as I am, because I'm confused.
Devin. How are you feeling?
Good, sleepy, just kind of like sore and
Really?
tight, but not pain.
Good.
Yeah.
So did you take a look at it?
I took it off to take a shower and it looks so good.
Oh, good.
It doesn't even look very bruised or anything.
How much is coming out of the drains?
I haven't actually dumped these out in like a day and a half. So,
Okay. Not much.
No, the first couple days it was like 20,
Oh, that's not bad.
15 or 20 every like 4 or 6 hours or whatever. But then the last like 3 days I haven't even been able to like measure what comes out.
So you've been able to take this down, shower, put it back on?
Yeah. These things are so itchy. Drains are the most itchy part of all of this.
Really happy to get these out.
Yes, so happy.
I just got the stitch right.
Yeah.
It's really easy.
Ew! Oh, it's so long in there.
Weird. Okay, it's gone.
Oh, I didn't know how much was in there.
It's just I know.
It's okay. It didn't hurt. It was just so
It's
weird.
weird feeling, right? Try to do it fast when it's
Yeah.
just out. Okay. And then I'll put a little through the other side too. Okay, one more to go, okay?
Mm-hmm. Worth it. Oh my god.
Yeah. Alright, good. You look awesome.
Yeah, it looks really great.
So I'm gonna take these off.
Oh, okay.
Look
It
at
looks
you.
so
You look
good.
great. I love the way this came out.
Yeah, right? It heals so well.
Perfect. Yeah. Your scars look really good. I love it.
Yeah, it looks fine. I have been putting, I know you put the tape on it, but I have been putting like Neosporin on.
That's fine.
Yeah, I
Yeah.
didn't know if that was,
No, that's great.
and on the
You can
drain
switch
holes.
to Aquaphor.
Oh, perfect. Alright, cool.
Neosporin's good for a short term, and then after a week or so, I feel like it's good to switch to Aquaphor
Cool.
because it's just more basic and you don't need antibacterial. You can get a little skin irritation.
Awesome.
Neosporin long term. But
Gotcha.
yeah.
Good, I have
Little
plenty of
skin there,
that.
that's
Yeah, it'll
good. I
come
would
off.
just do Aquaphor. Perfect.
Awesome.
You don't even have any swelling, right?
No, not really.
There's probably a little
It
bit.
feels a little bit like bruised still
Yeah.
especially when I like take on and off the bandages, but for the most part,
One more week of these.
Yes.
And then you're done.
okay.
And
Got
then
it.
one more week of good compression.
Okay.
I think it'll be important.
Awesome.
Yeah.
Awesome.
So, any
Cool.
questions about anything?
I don't think so, yeah. That's it.
All right, great.
I'm so excited with it. It's so good. It looks so good. And there's like no scars. I can't even tell where the 2 poles on the sides were anymore. There's no scars. There just isn't. You can't see any of it. It looks so good.
Thanks for watching, everyone. If you liked this video, please hit the like button below and subscribe to this channel if you've not already, because there's a lot more content coming. Please comment below if you'd like to see other videos that are similar or of a different topic. Please let me know what you'd like to see.